Now, this all comes with a practice. The more you practice your photography, the more you get the angles. Coming to the extraoral photographs. Extraoral photographs are very important. They also should be in a standardized condition at constant distance, constant camera setting, and constant quality of the light and precise positioning. So what I do in my practice, I have a particular zone in my clinic where I ask patient to stand to take a picture, and I know from where I have to take it. So I take all the patient pictures from a certain angle and from certain place with a certain light situation. If I keep changing my location in the clinic, I have to change the light source. I have to deal with the focus and the shadow issues. So the best thing is that you enter in your clinic and you just ask your assistant to stay, the background should be white. So stand in different places and you try to take a picture and see at what position there is no shadow. So you can utilize the daylight. In four walls, there must be some place where you can get a picture without any shadow, right? So you can get the picture of the patient and ask your assistant to, then you know your correct position, at what position in the clinic there is no shadows, and this you categorize, this is my photography station, and all the patients should come stay there with a certain distance and you take a picture there. So what are the American board requirements for the extraoral photographs? Again, the quality and standardized photographs, either the black and white or color, both are accepted. The patient had oriented accurately in all three plane of space and in the Frankfurt horizontal plane. How you do it? Ask patient to look straight. That's it. Don't look up, don't look down, just look straight. On lateral view, facing to the right. So don't ask patient to turn left and take a picture and then try to take the mirror. Always ask the patient to face to the right, and their lips should be relaxed, not tightly closed or too much open. There should be a relaxed, the picture should be in a relaxed position. If patient can't able to close their lips, ask them to relax it. We can deal with the disharmony, okay? But don't try to force anything. Just be relaxed. Look straight and be relaxed. One anterior view with a serious expression, optional one lateral view, and one interior view with lips apart in a smiling position. Optional one anterior with a smiling, and the background should be free of distraction, should be white color, should be a quality, having a quality lighting. There should be no shadows in the background. Ears should be fully exposed. The eyes should be open, looking straight, and patients should not wear their glasses while having the pictures. So this is the extraoral pictures of the patient. If you see this patient, what you can find is you have to do the cropping at the level of the clavicle, okay? And then you give some space on the top, some space on the right, some space on the left. The patient should look straight, yeah? So there are 1, 2, 3, 4, 6 pictures. 2 are the smile close-up. 1 is a straight smile close-up. The third one is a 3/4 smile close-up. And how you get 4 of these pictures, here the patient looking straight in the camera at their Frankfurt horizontal. Then here the patient neck should not be overextended, should be straight, should looking straight and no smile. Then you take 2 smiling picture, ask patient to smile in 3/4 and ask patient to smile while looking at you, okay? So let's go in detail. In the frontal view, the standing or sitting against the white background should be at the same height. So if the patient is shorter than you, then you have to bend down. If the patient is taller than you, then your camera should be pushed up, like you have to put your hand up at the level of the patient height, okay? And tell patient, don't look at me, look at the camera, okay? You have to look straight, you have to look straight in the camera, okay? The camera can go up, the camera can go down. The focus on lower eyelid, middle of the face. When you're doing the face picture, your cursor should be lower eyelid and the middle of the face, okay? And it's always in a portrait format, not in the horizontal, okay? So keep it in the portrait format. Don't think that you can make a landscape and you can change it. It not come correctly. When there is a landscape needed, you do the landscape. When the portrait is needed, take a picture in the portrait. Extend from the top of the head till the clavicle or the larynx. The picture should be bilaterally symmetrical, so equal exposure of the ears, okay? Interpupillary line should be parallel to the floor, so head should be straight. It's very important to use the grid while you're doing the take a pictures. It should be in the natural head position, look straight in the camera. There should be no shadows. If you see here, you can see a shadow here. And this is not acceptable. Here you can see a shadows. I should have placed patient into another wall and try the same picture, okay? The lips should be relaxed, not strained at rest. There should be a natural smile, not the forced smile. On the lateral profile view, you can ask patient turn to the right and only right view is required, not the left. But in case the patient have a facial asymmetry, then you have to take right and left face, okay? Extend top of the head till the clavicle in natural head position with lips relaxed. Exposed ear completely, so you see the full ear. Ask patient to tie the hair or put the hair at the back. Looking straight, and there should be no shadows here, okay? So you can see the full face line with no shadows. The 3/4 view, the mid-face deformities. To rule out the mid-face deformity, the class 3 patients, we use this view. So this is very important. Ask patient to turn their head at 45 degree, okay, till you see the contour of the eyes. So you can see this whole eye and this, you can see this half of this eye or the contour of the eyes, okay? And ask patient to smile and then you take the picture. The focus is again at the level lower eyelid or the mid face. Then you go to the close-up smile. It's basically the crop of these two pictures, but actually you have to take a separate pictures for close-up. So when you try to zoom it, it comes in perfect resolution. Then there is one additional view, which is called as a submental view. It should be taken in only in the case of facial asymmetry, especially mandibular asymmetry. You can ask patient to look up and you take a picture from the bottom.